Hey eGP learners, welcome to our roundup episode of the eGPlearning Podblast, where we look back and more importantly look forward to 2020 in terms of what's coming up. Let's tech enhance your primary care and learning.
So welcome. I'm Dr. Andy Foster.
And I'm Dr. Hussain Gandhi.
And Happy New Year!
Yeah, Happy New Year, guys. Hopefully you're enjoying the festive period and stuff. And this episode is coming out to you just a couple of days after the New Year. Woo. Hope you've had a great time. Yeah, party.
Okay, good. Yeah, it feels a bit strange. We're recording this in December.
Yep.
Ahead of the election, so who knows what's happened. But that's enough said about politics for today.
Yeah.
So what are we covering today, Gandhi?
So we're going to have a look back at what we've been doing and reminisce about our previous episodes and stuff. And hopefully you guys have seen our episode with Ben Gowland as we talked about the Podblast specifically and what he's been up to, what we've been up to and all that kind of stuff.
Yeah, and that was a great episode.
Definitely. And now we're looking also to the future.
Good. But first, a quick word about our partners.
Yeah.
HTN, the Health Technology Newspaper, your daily dose of health technology news for the health technology community.
Definitely go check them out, guys. We do it on a regular basis, and in terms of the information they give us, in terms of what we talk about, actually a lot of it comes from the stuff they cover. So,
yeah, they're a great source of stories. They take everything that's out there and condense it into something useful.
Definitely. And a shout out to our regular listeners, so Sonali, NCGPA, Knots LMC. Hi guys. We've also got Jem Stambaraja, Ben Gowland, as you've seen in our recent episode, JC Melody, and also a couple of shout outs to James Fraser and Kevin Thomas. Hi guys.
That's good. I think we've covered most people. So.
Yeah. If we missed you, we apologise, and definitely let us know.
Let us know. Send us a tweet. Excellent. So I guess, Gandhi, a good place to start is perhaps reflecting on some of the changes that have happened over the last year in the world of primary care, the Podblast and health technology in general. What have been some of your highlights?
I know the biggest one for us definitely would have been PCNs and stuff. So as many of our eGP learners will know, we're both PCN directors in our local patch, and clearly it's had an impact on primary care over the past year.
Yeah, and came out of nowhere, really.
Yeah, well, I mean, there was musings about this big change coming through. You know, the GPC and the BMA have been talking about it. NHS England have been talking about it following the birthday present that the NHS got from our previous Prime Minister or previous two Prime Ministers.
Who knows?
You guys can tell us that. Yeah. But yeah, in terms of, obviously, something was coming and we got PCNs, basically.
Yeah, and they've been really exciting, time consuming, but that's been a big part of both of our years. Definitely. So shout out to PCNs there. Gandhi, you've been up to much else over the last year?
Well, I think the biggest thing for me over the past year has been I've been doing a lot more event speaking. So I've been to quite a few events, which many of our eGP learners would have heard me talk about on numerous occasions, either on this or in the emails and stuff that I send on a regular basis, the eGP Learning News Blasts. You know, if you want to sign up for that, guys, make sure you do. We'll put a link down in the show notes and stuff. But yes, I actually quite enjoy it, you know, going to all these different kind of events. So there's been various ones. Amin Aurora's GP conferences that he's been doing. RCGP conference, that was awesome, speaking there, and a few other speaking events. I even did a speaking event through a web conferencing to one of the LMC areas in Hertfordshire. So that was really interesting.
You've been extremely busy. I remember I quite enjoyed doing our participation in the health technology news digital weeks that have happened a few times, and doing some webinars for them.
Yeah,
that was really fun.
Definitely, guys. You know, sign up for the one in January as well. It's coming in. We will be back on that as usual. So yeah.
Excellent. And something I've been enjoying, and we did some videos about it. So really enjoyed making our videos about Zoom, the video conferencing software. One of my highlights of the year has been seeing some of the organisations that I work with really embrace Zoom and video conferencing, particularly our sort of network of networks. So all the primary care network CDs and deputy clinical directors in Nottingham are having regular video conferences?
Yeah.
I would say consultations. But we're getting together regularly via video to cut out the travelling time. And it's the first time that I've felt something like that really work. But it's really worked and it's kept momentum.
Yeah, because I think we've tried it in the past, but it's never really been that great. You know, telephone conferencing has never been something that I found helpful, apart from taking out the whole issue of having to go down to London or something for a meeting. But in terms of participating, it's not been that great. Whereas the video conferencing we've been doing has been so much better.
So, anything else, Gandhi?
So we've been talking about our digital fellowship for the past few months and stuff, and you know, hoping that matures, I think, into something that's going to be really impactful for the local area. And, if anybody out there wants to follow suit in terms of creating a digital fellowship, we're more than happy to talk to people about how we've done it, how we've approached it, and also what it can consist of. So definitely something that we've had lots
of materials to share there, and it's been really fun working with Health Education East Midlands and the local medical committee to promote and try and get that off the ground, and we've just about got there, I think.
We think so, yeah.
So that's great.
And what about you, Andy? What's the one?
I think one of my highlights, and this is something that I was talking about at the close of 2020, we did a big redesign of our website at the practice.
Yeah.
And it's been really fun using the tools that we put in place there to deliver regular updates for our patients. We've been using video, made a nice video about feedback. We've also taken some video from our patient group and put it up there, the patient group update. So we've been really experimenting at the practice using technology to communicate with our patients, which has been really good fun. And I'd encourage you all, you can go and have a look if you like, www.parksideMedicalPractice.co.uk, and take a look, see what we've done, and comment.
Definitely. So, one of the things we wanted to cover in this episode was looking back as well. And definitely check out our episode with Ben Gowan, because that's been a more in-depth look at what we've been up to. But we're just going to briefly summarise for you guys listening to this one. So we've had some amazing guests, haven't we?
Gandhi, pick a highlight. Who was your favourite guest?
Definitely. There's two that come to mind, but Nikki, Kanani, having the opportunity to speak to her and have her on the podcast, and being taken for a tour of her house. How many people can say
her board game shelf?
Yeah, exactly.
Which consisted mainly of Monopoly, if I remember. She loves all sorts of Monopoly.
Yeah, multiple different versions, and you can question why she needs so many different versions, but fair enough. We got to see inside Nikki Kanani's house and all her.
Yeah, does that mean she's more in favour of privatisation in the NHS than she might think? Oh, I don't know. Controversial.
Yeah, definitely.
Probably not.
What about you, Andy?
So Liz Ashel-Payne, I know she sometimes tunes in and listens and looks at our tweet feeds. CEO and founder of Orca, the organisation which reviews and rates and gives us the ability to recommend directly apps to patients. I thought she had a great story that we covered on the episode, from how she got inspired right through to running this company and being involved in NHS innovation strategy. Really, really inspiring. So that was great, and she spent some time with us afterwards, connecting us with other people.
Definitely,
she's very generous with her time, so she was a highlight for both of us, I think.
Yeah, and I guess in addition to that, we've been doing quite a lot of work to try and improve the Podblast for you guys. We know that at points it got a little bit tapered, shall we say? Yeah. But definitely in terms of, I know one of the things I've really enjoyed, particularly over the past couple of months, is we've had a regular base that we've been recording from, and also turning them into video episodes, like what you can be watching right now. So that's been awesome, and we've got some tech improvements coming as well. Yeah,
we've been experimenting with different audio, video capture and things, so you've probably seen the quality go up a little bit, down a little bit, but I think we're settling into our current setup, and we're looking to treat ourselves over Christmas to some new technology. So hopefully you'll start to see that put into place in the new year. I think we've also resolved to try and be better in terms of quality, content, and consistency. So we're going to try and be more consistent, and we've got some ideas about how to do that, which in fact we probably do with your help with.
Definitely. Yeah, no, we've been asking you guys to tell us what you've been interested in and what you want to hear from us. And like with many other podcasts, we're going to ask you to do a survey. So dead easy to find and do. So it's So the survey is bit.ly/Podblast Survey 19. Okay, so Podblast Survey 19. We'll put the link in the show notes and stuff, guys. If you could fill that in, it will guaranteed take you no more than 5 minutes. But filling that in means that we know what you guys want to hear from us. And
who you are, what you want to hear, so that we can deliver on our commitment to help the health technology community grow and prosper.
Definitely. And the information we get from that will feed into what we provide for you over the coming year. And we've got some awesome stuff coming for you, we hope. But making sure that's fine-tuned and stuff.
So I'm excited about the next bit. So It's sort of awards season, isn't it? Kind of close to the year,
When
starting
you
the
come
new
to
year.
the end of the year, you want to review and maybe give an award or two. So we've got 3 awards that we're going to give out in a second. And first and foremost, we wanted to do the most innovative primary care tech company.
So I get the prize here. So there's an engraved tankard, which may or may not wing its way to the winner.
Yep.
So Gandhi, the award, the eGPlearning award for the most innovative tech company 2019 goes to
Orca.
Orca. Good choice.
Definitely.
Excellent. Why are Orca deserving of this accolade?
Well, I think there's a lot of amazing contenders out there, but I think for us, in terms of stuff that we've seen in terms of innovation, that I think they lead the pack. That they've created a product that does something that nobody else really does, and it does it really, really well. And I think we're going to see more and more of being able to prescribe apps to patients with the digital agenda and that kind of thing, and it is just a slick piece of kit.
Yeah. And for me, they've delivered the whole package on a concept. So, okay, apps as a therapeutic intervention. And they've addressed a lot of the problems that are there. So they are reviewing them, providing a bit of evidence base for efficacy, addressing some of the sort of safety, information governance issues, so that GPs and health professionals have the confidence to prescribe them. Yep. They provide a prescribing platform so you can actually do it and get these links onto the patient's phones, and they've really gone at it with good kind of scientific rigor, I think, as well. They've got a good process. They're setting some standards in the space so that people can have confidence to use them. So a lot of respect for what Orca is doing. Yeah,
and I guess just a sidebar, we are a sort of an affiliate of Orca and things, so if you guys wanted to check out our video and how to use Orca effectively in primary care, we have a little video that shows you how to do that, how you can sign up and all that kind of stuff, and you get free stuff for it. You get 3 months free for no cost whatsoever, and if you did want to do it after that, it's cheap afterwards. So like I said, we do get a slight affiliate for that, so no extra cost to you guys, but if you wanted to check it out, feel free.
And of course this had absolutely no influence on Orca winning, and in fact I forgot about that just before Andy mentioned it. Next award is
the Disruptor of the year when it comes to primary care.
So Disruptor, I think we had a sort of this holy hand grenade. It's actually a golden pineapple.
Yeah. So Andy, who do you think is going to win this one?
The golden pineapple for the Disruptor of the year, and I hasten to add, disruption is neither good nor bad.
Yeah.
Shakes things up. I think actually it's probably a good thing.
Yeah.
I think to be disrupted.
So the winner is?
And the winner is NHS England.
Yeah.
Surprise winner. And this is mainly because of primary care networks.
Definitely.
They seem to really be shaking things up and moving things forward in the primary care space. At least that's my unbiased opinion as a primary care network clinical director. And they came out of nowhere, hence being disrupted. These were on our radar last Christmas, New Year, but I don't think we were really talking about them as...
Not as an entity.
Or I don't think we were particularly excited about them. But I'm quite excited about primary care networks now.
So it'd be interesting. There was an honourable mention. So we did kind of reflect on the fact we didn't do this last year. And if we had, there was definitely a winner from last year's. So that was Babylon. They haven't won because I think PCNs have, for the entirety of primary care, been an absolute disruptor. But definitely Babylon have led the charge with online consultations and that kind of stuff.
And disrupting business models.
Definitely.
And requiring a response from NHS England, which we discussed in our recent update.
So unfortunately, Babylon, you didn't win the Golden Pineapple Award, but
you are certainly disruptive.
Yes, definitely.
And disruptive is not always bad. It shakes things up and moves things forward.
Definitely.
So good.
And then last awards. So we thought long and hard about what our last award should be, and I know for me and Andy that there's definitely been one thing that we've had a bit of a challenge with, and that's recording some of these episodes. So we thought we'd give an award for the trickiest episode to record, and we've got the Roland Rabbit Award for.
This is actually Oswald the Lucky Rabbit.
That's it, Oswald.
The forerunner to Mickey Mouse.
Yeah.
There we go. And so Gandhi, the Oswald the Lucky Rabbit Award for trickiest episode to record goes to
the Zoom episode. So actually, this was a bit of a challenge for us, purely and simply because of technical difficulty, and we ended up having to do it 3 times, I think it was, wasn't it, Andy?
Yeah, it was difficult.
Yeah. So even though the Zoom system worked perfectly, it was actually our own things. We got the sound wrong, we got the the streaming was a bit wrong. We ended up having to do it from separate locations, which is kind of what the Zoom's
I think we hit the limit of your Wi-Fi at your house, Gandhi, because we were trying to, I think, send data in all directions.
Yeah, unfortunately didn't cope with it. So that was a big challenge for us, but there was definitely a clear runner-up with that, and it goes as a definite honourable mention to Jeff the dog. Our consumables episode we actually recorded 3 times, I believe.
Wearables,
that was it. Consumer wearables episode we had to record 3 times because Jeff just decided he wanted to join us.
Jeff just wanted to bark, so maybe we'll pass this award on to Jeff.
We shall see
in the near future. Excellent. So that was a lot of fun. We'll have to do that again next year.
Okay. So next up is the future. What have we got coming for you guys? Well, we've definitely got more interviews. We've got some planned for you, and we've also got some more deep dives because we really enjoyed doing those episodes in terms of creating content that hopefully can navigate for you, our eGP learners, what kind of stuff is around really, and you know, in terms of feedback, we get really cool stuff from that. And we're still going to do some of these update episodes, so keeping you informed of what's going on in primary care from a health tech perspective. So definitely those 3 things we are thinking are going to keep coming to you guys thick and fast, and every couple of weeks you'll be able to tune into us to see that content or listen to it on the podcast. And
we're going to try and drive the quality up in terms of content and the technical quality as well. So excellent. And so beyond, in terms of more generally serving the primary care health technology community, we've got some plans in that department because we think it doesn't start and end with a podcast. You know, our mission is to support and develop the primary care technology community. So, what things have we got planned for that, Gandhi?
We've got quite a few things. So we are looking at creating online courses and toolkits for you guys, because it's one of the things we constantly get asked, actually. How can we share the learning that both me and Andy have in terms of what we come across, what we've learned, how to do things, that kind of stuff. So actually the easiest way, whilst we're more than happy to come and speak to you guys about it, and you know, unfortunately we only have a certain amount of time, so online courses and toolkits, definitely they'll be coming through in 2020 for you guys to help learn a lot of this stuff with us. What else, Andy?
What else? So on the 12th of December, which will have passed into history by now, we're having the first, the inaugural meeting of Health Innovation East Midlands. So we talk a lot about a health technology community, and these things do exist in in other parts of the country, but there isn't really an active health technology community in Nottingham. And that's something, since we're based in Nottingham, that we thought we should do something about.
Definitely.
So you can check this out at healthinnovationem.co.uk. And we started some local meetups to bring together people interested in advancing health technology in the East Midlands.
Yeah.
And we'll let you know how that's coming on in the coming year.
When you listen to this episode, so our next event will be the 6th of February in Nottingham. So if you want to join us, check out the links and stuff. You'll be able to see all of that and hopefully join us along. Already our current event that we've got is almost booked out. So it's going fast.
Clearly demand out there for this.
Definitely. So, and then in addition to that, we're going to lead into something that we're quite hopefully proud is going to happen and get done and stuff. Not like Brexit. But our conference. So we're going to run a conference in the summer of 2020, and listen out for TEPCAL 2020, guys.
So Gandhi, TEPCAL, what does that stand for?
So that stands for Technology Enhanced Primary Care and Learning. Kind of what we do, really.
It's great. You've invented a whole new word. I've never heard TEPCAL. Never heard of that before.
So I'm sure within a year or two's time, TEPCAL will be in the Oxford Dictionary, along with all the other kind of things like FOMO and JOMO and all that kind of stuff. But
be the new word for 2020.
Definitely. Anything else, Andy?
So as you mentioned, we're interested in doing some online courses and toolkits. I think one of the areas that we think primary care, GP surgeries, primary care networks could focus on and really use fairly easily with a bit of a guiding hand is using video more in primary care. So that's something I'm quite excited about. We did a few videos at the practice. Our local federation, hello NCGPA, have been embracing video over the last few years. So I'm excited about more video going on. I think it's a great way to communicate with patients. Yeah,
and definitely some more stuff in terms of productive general practice as well. We've done a few episodes on how we can hopefully help you streamline your workflows, make things just a little bit more easier for you guys out there, including other kind of stuff like social media as well as online consultations as well, because that's going to be a big thing coming forward, obviously. So if we're looking at what we're doing, I guess we need to consider what's in the wider system as well. So Andy, what are you most excited about when it comes to health tech and things?
Okay, so I'm excited about mass adoption of digital healthcare.
Okay.
I think the time is now. I think these things need to reach a critical mass, a critical user base, for them to really start to go mainstream and become useful. And I think the NHS app, which hopefully practices and patients are beginning to get signed up to, I think that's the platform and the catalyst for taking digital healthcare more mainstream. So I'm excited about the NHS app and that will drive uptake and adoption of digital healthcare, like accessing your records, booking online, all of these things. And what else are we excited about in primary care?
So, as you mentioned, Andy, I think organisations being able to embrace technology, and we've seen this not just in terms of primary care itself, but other organisations that we've been working with as well. So you talked about our local federation, but also the LMC, RCGP, an organisation that sometimes has been a little bit slow, but I think it's definitely looking forward. They've got their digital strategy, and I've forgotten the name of it now, but they are definitely looking forward. Show
notes. We'll link in the show notes.
Yeah. Fit for Future, that was it.
There we go.
Yeah, so Fit for Future, so they are looking forward, and I think a lot of organisations are recognising that digital does have an impact. Clearly, there's always going to be the debate about good or bad, but it has an impact. There's no question on that. Anything else?
So I'm excited again, and it's more about this going mainstream. Bit of a theme for me, but I think we're going to see more consumer health devices being used.
Definitely.
So, as I've mentioned before, I'm excited about this. The whole mobile phone revolution has meant there's cheap sensors, components, microprocessors that are allowing people to build more and more consumer electronic, consumer healthcare devices like your smartwatches and beyond. And I'm just excited about that going more mainstream and hopefully beginning to become useful. So we're seeing platforms. I think platforms are planning to go online in 2020. So regionally in Nottingham, we're going to have Patient Knows Best. Hello, guys. We'll link to you in the show notes. And there's going to be the ability for patients to link in with their health devices via their mobile phone, upload data to the app, blood pressures, weights, heart rates, and those are going to be visible to our clinicians who are going to be working out what to do with that information. But
a lot of data coming.
But it's going to be unstoppable. We're going to have to do something with it and make our way through it, and I'm quite excited about that. I think that's going to be interesting.
And I guess for me, you talk about the device and stuff. I guess I'm more thinking about the future is going to be connectivity between the individuals. So, between practices, between individuals in practices, and between practices and other organisations. So, secondary care, community services, we're going to be more connected in terms of how we tackle the community care question, I think, is probably the other way of looking at it. And I think that's going to be a major shift, and making sure we've got the systems and process in place to help support that. So recognising that, you may get things coming from anywhere and everywhere and making it manageable.
That's true. The problem with connectivity is information overload, as we discussed in our email episode.
Definitely. So we've talked about, I guess, our predictions for the future and stuff a little bit and what we're excited about. But let's actually talk about our predictions for the future. So Andy, what do you see about the future? And let's counterpoint that with... We made some predictions.
We did last year.
Yeah.
So let's recap on our predictions for 2019. So my prediction was, I think at 2018, I thought we were at peak AI hype, around artificial intelligence. And I said, we will talk less about artificial intelligence in 2019 than we did in 2018. And expectations will lower. So Gandhi, grade my prediction. Did that happen or not?
I think that pretty much did happen. So even the big tech companies themselves are starting to turn around and say that AI isn't the thing that we all thought it was going to be. It's had an impact, and then there's been quite a few stuff looking at how AI can work in primary care in particular and other aspects of healthcare. But generally speaking, it's gone a little bit colder than it was. I
remember Babylon Health CEO, interview. I think it was in the FT. We were reading about how he was talking about how AI is going to dramatically reduce the need for doctors, and we were talking about things like that in 2018. That's not been happening so much in 2019.
No. And like I say, even the big tech companies have said that AI is not what people thought it was going to be. It's, Google and stuff are investing less money into AI compared to what they were. It's still going to have an impact. There's no question on that. But the way it's going to have an impact, I think, is going to change.
And Gandhi, what was your prediction?
So my prediction was the rise of personalised medicine. I felt that we were going to see more of people being able to look at individual care for themselves and how that is applicable in terms of their, forward care, so lifestyle, that kind of stuff. What do you think, Andy? Was I right?
I'm going to say no.
Okay.
However, I'm going to say I think you were ahead of your time.
Yeah, maybe.
I think there, because I can see that totally coming. Even more of those building blocks are being put into place now.
Yeah.
With NHS app. Yeah. And the ability to link in with these connected devices and get more and more data, and I think that's what we need before we get to personalised medicine. But we're not there yet. But we'll get there.
And I think the PCN agenda's also had a hand in that, because that's shifted the focus away from personalised care to population-based care, so local populations and things. And I think that's part of the other reason why we've seen less of the individual personalised medicine agenda. But you're right. Maybe it was a bit too early.
Ahead of your time.
Yeah.
So, and last year there was somebody else here who made a prediction. Shubs was a guest on our show from 2 GPs in a pod.
Yeah.
His prediction was he predicted that we would be improving. It was quite a vague one, wasn't it? But he thought that technology would facilitate more time and better communication between primary and secondary care and beyond.
Yeah.
Has it happened?
I think it's starting to. So we talked about video conferencing as one method, and we've seen other kind of things in terms of workflow procedures coming through. So I know some practices are looking at using workflow to reduce letters, workflow to reduce pathology reports, and that kind of stuff. So I think we are seeing some of it. Maybe that primary to secondary care interface, maybe not as much, but I know there are also some network areas which have done some amazing work at trying to tackle that. So, I think we're seeing it a little bit. So maybe Shubs was actually the most accurate out of the two of us.
I'm going to give him a true on that one. I think we've moved in that direction. And Shubs, if you're out there, you can respond, tell us what you think about our predictions from last year and where you think we're at. Good. So, and finally, before we finish, let's make one prediction each for 2020.
Okay.
So, Gandhi, do you want to go first with your prediction?
Okay. What do you think? I think in 2020 we will see online consultations go mainstream. I think I'm confident in this prediction, purely simply because 2021, it's in the contract, so it kind of has to happen by 2021.
Is that cheating? But anyway, carry on.
No, because it's not until 2021 it goes mainstream.
Okay,
but I think it will happen in 2020. We're seeing that locally, hopefully, with some of the stuff that we've been involved with, but also nationally as well. The agenda is moving towards digital primary care. So I'm confident on this one this year.
I like that. It's a good prediction. Kind of a safe bet, but it's a good one.
I want to win. What can I say?
Okay, I'm gonna. So last year I made a bit of a kind of negative prediction, or about something that wasn't going to happen. So this year I'm gonna put my neck out. I'm gonna say we will be talking about next year a problem, and that problem will be an increase in workload resulting from the digital first agenda and the NHS app. There's going to be good things, but I think there's going to be bad things. And I think unless implemented well, we're going to be worried about that increased access that patients have is resulting in increased workflow, increased number of messages coming into practices, increasing potentially demand driven by this new access that patients will have. So I think that'll be a little negative story that we're reflecting on this time next year.
That's also a safe bet as well, to be honest.
Oh, do you think?
Yeah.
Okay, that's good.
Well, I think you're right, because a lot of this will come down to implementation, and that's one of the things that people sometimes forget about. And we've seen experiences of that. People get blinded by the tech itself and forget about the implementation.
Very true, and unintended consequences. So that about wraps up our New Year's episode.
So we hope you enjoyed this episode of ours. Like I said, we just wanted to do a little bit of a looking back and definitely a look forward in terms of what we've been up to. And again, to help us with that looking forward, please fill out our survey. So that link for you guys again is bit.ly/podblastsurvey19. It will only take 5 minutes of your time. I guarantee you on that. And we keep to our word with these surveys. If you're not done in 5 minutes,
you can just stop.
Yeah, stop. just don't do it. But we guarantee less than 5 minutes. I think it's only 4 or 5 questions in total. It'd be really helpful for us in terms of what we can deliver moving forward for you guys and stuff.
So, thanks for listening. What are your predictions for 2020 and what will be coming our way in the world of primary care health technology?
And if you guys want to let us know, definitely contact us on any of the platforms that you like. So we're on Twitter, we're on Facebook, we're on LinkedIn, Instagram, YouTube. Definitely leave us a review on the podcasting platforms, particularly iTunes. We'd love it if you could just go on there, quick little review, tell us what you think, whether we're good, whether we're bad. Either way, we don't really mind because any feedback is great. And definitely make sure you click the bell, subscribe to all of our content so you get it first and foremost and hear all of this stuff straight away. It means so much to us every time we see that little ticker go up, up, up. Really does. Particularly me.
So it's goodbye from me, Andy Foster.
And goodbye from me, saying Gandhi, and we'll catch you in the next episode.
Okay, ta-ra.
See ya.